A very good morning to all. At the outset, I would like to thank AIOC and Dr. Sushmita, Dr. Pandav, and whole Glaucoma team PGI for giving me this opportunity to speak on this topic. So, I'll be discussing in my talk from very basic about the UBM, how to set up the machine, how to do patient preparation, how to do probe preparation, and what are the various techniques to do UBM. So I hope that after attending this session, everyone will be able to do UBM on their own who have this machine. So it will be a video-based session. So first, setting up the machine. So machine has various parts. It has printer, a monitor, a console, a probe, and UPS and CPU. So first, we need to turn on the UPS, then the CPU, then we start the console. When the console is on, here we can see the console is on. So the probe is of 50 megahertz, so this machine comes with B-scan also, so 50 megahertz has to be selected. Then patient entry is done. So patient details are very important and they has to be saved very properly because UBM is routinely done in children on follow-up basis. So to study the follow-up also, we need to have the right data. Then here the machine will appear like this. So here we need to select the eye properly. So here we can see the option is there. So we need to select the right eye or the left eye. And we can interchange these eyes in between if we need to see the other eye during examination. So once we are ready, we press the foot pedal and then the UBM will start. So this will appear like this. So this was setting the machine. Then we will be coming to the probe preparation. How to do the UBM procedure. So things required for doing the procedure are distilled water, viscoelastic, clear scan or scleral shell, a speculum and a saline. So we need to have these things ready because in children the procedure is being done in GA in non-cooperative patients. So we need to have all things ready. So the probe appears like this. So here we need to see this is the mark. Like on every ultrasound probe also this mark is there. So this is very important to understand the orientation of the structures. So wherever the mark we align, that part is appear on the right side of the screen. So this is very important to understand the orientation of the images which we will be getting during the procedure. So first I'll be demonstrating the scleral shell technique. So it is the most commonest of all which is done routinely. So first we open this cover of the probe. Then there is a space. We need to fill this with distilled water. Care should be taken that not normal saline, RL or any other fluid should not be used because those ions will stick to the probe and it will affect the transducer. So it has to be filled completely with the distilled water. Here we can see the inside what we can see the structure. This is the transducer. Then it is covered with this clear cover and here we can see the movement of the transducer. So when this transducer moves, here we can see with the movement of the transducer, the images will appear like this. It means the probe is ready to use. So this procedure is done in supine position. Patient lies comfortably. First parakin is inserted topically. Then this is the cup, which is fixed in the palpebral aperture. The cups comes in various sizes, so care should be taken like in children. If the palpebral aperture is small, we need to choose a smaller size, and if it is large, we need to choose a larger size. Then this cup is also filled with sterile water. It is more of a coupling media and it is an immersion based technique. Then here we can, this patient I am demonstrating is a post-trap patient. So to understand the anatomy very well. So here we can see the mark is aligned inferiorly. Okay, so on the images you can see when the mark is aligned inferiorly to superior we have the bleb. So here we can see the PI and a scarred bleb. So this is the image. So for ideal good image quality, the images should come between those lines which were coming and we can save these images also. So now I'll be demonstrating the clear scan technique. So it is very useful technique for children, and this technique can be used in supine as well as sitting position also. So this is the clear scan cup. This is very delicate. The difference in both the technique is the cost. This is a disposable cup, but it can be used multiple times. Company suggests for single use. It is very delicate. It is filled with distilled water. Care should be taken not to touch the film, because if we will touch it, then it might rupture. So it is completely filled like this. Then we fix the probe. There no need to apply the cover in between. So we fix the probe completely like this. Here is a button. This button is pressed to insert it. It should be inserted completely tightly to appear like a bullet, so that there is no air in between. Now you can see we can tilt it anyhow. It is now like a normal ultrasound probe. So we can use it anyhow, even it like this also. So you can see the movement of the transducer and the images come. The images come of really good quality in this because there is no in between any media. So for this we need to apply a speculum in patient's eyes. This technique is very useful in children because children sometimes purchase small, large, so they are very comfortable with it. Then we need to apply viscoelastic after putting Paracane, because it will directly contact the cornea, so as not to create any abrasions or anything. So here also we can see we will directly have a contact of this thing, and this similar thing we will be demonstrating, that inferiorly we are keeping it, the same patient. So you can see the same thing, that on the left side we are seeing the PI and the bleb area. So the procedure is different, but the images qualities are similar. So what are the special consideration for children? Because procedure has to be done under GA for small children, because children are not cooperative many a times. So it can be clubbed with examination under anesthesia, so as not to give anesthesia again and again. The sizing of scleral shell has to be selected appropriate for palpebral aperture size, and clear scan technique is more useful in children because children are more comfortable with this. So the take-home message for today is doing UBM is an art, and every glaucoma specialist should master it, as UBM can unravel many mysteries underneath the cornea. As in childhood glaucomas, the corneas are mostly not very clear. So to find what is beneath it, a UBM can be a really good tool. So I would like to acknowledge Dr. Pandav, Dr. Sushmita, Dr. Sagarika and whole glaucoma team, and most importantly my patient who cooperated and gave consent for the video. Thank you so much for patience.